Wide-awake hand surgery has been around actually for some time, but has become more recently popular. And what it is we attempt to do a hand and upper extremity operation with the patient wide awake. There are a lot of benefits to it. There are no anesthetic risks, such as nausea, vomiting, feeling groggy during the day, and also the larger risks of cardiac issues as well as respiratory issues. So that's number one. Number two, it offers a lot of convenience to the patient. We have started doing a lot of these procedures, these wide awake procedures, in our office. Sometimes we will do it in the operating room as well. The patient oftentimes does not need to be what we call NPO, meaning they can eat the morning of surgery. And the patient oftentimes can drive themselves to and from the operation. Number three, it's very cost conscious. So with a wide awake hand procedure, anesthetic costs are minimized, and operative costs such as a facility center can be minimized. The basic process, for example, if a patient had what we call a trigger finger, the patient would come to our office on the morning of surgery. We would first numb up their hand in an area, and typically patients will feel a brief moment of stinging pain when the needle enters the skin, and then after that, they typically have no more discomfort. We bring the patient back to our procedure room, and we perform the operation, which takes less than 5 minutes to do. And during the operation, we can play the music that the patient enjoys. After the surgery is done, we put a soft dressing and the patient can go home. The other thing with wide-awake hand surgery is that more and more we're learning that the outcomes can be improved. One of the more common procedures we'll perform with the patient wide awake is a flexor tendon laceration. A flexor tendon are the tendons that bend the fingers into the palm, and they're very commonly lacerated. The struggle with the operation, if the patient is asleep, is that we don't know how good of a repair we performed. If the patient's wide awake, we can test that repair immediately after we fix it. That's a very good example of a procedure where there is an enormous benefit to the patient being wide awake.